Your baby has finally arrived. This is a very special time for your family. The first 5 days are full of new experiences. Mother and baby need dedicated care now. In the UK, the National Health Service, or NHS, provides this support. This care begins immediately after your baby is born. It is designed to help you both recover and bond. Professionals are there to guide you through these early moments. Immediately after birth, a midwife is with you. The midwife is a key professional in your care. They check your baby's breathing straight away. They listen to your baby's heart rate carefully. Skin-to-skin contact is very important now. It helps your baby feel secure and warm. It also helps to regulate their temperature naturally. The midwife will assess your baby using the APGAR score. This score checks your baby's overall well-being at 1 and 5 minutes. The midwife also focuses on the mother's health. Your recovery is very important too. They will monitor you closely after the birth. They check for any excessive bleeding and uterine contraction. They make sure you are feeling comfortable and supported. If you need pain relief, they will discuss suitable options. If you had stitches, these might be checked for healing. This early support helps your physical recovery begin positively. The midwife will help with your baby's first feed. This is an important bonding moment for you and your baby. They offer support whether you choose breastfeeding or bottle feeding. For breastfeeding, they help with latching and positioning techniques. Your baby will be offered a vitamin K injection. This helps to prevent a rare bleeding disorder in newborns. It is a standard protective measure for all babies. Your baby will also be weighed and measured accurately. These initial records are important for tracking their early growth. Please like, subscribe, and share this video to support new parents everywhere. Midwifery care continues after the birth itself. If you are in hospital, midwives provide ongoing support. They check on you and your baby regularly throughout your stay. They answer your questions and offer reassurance whenever needed. This continuous care is very helpful for new parents. They want to ensure you both are recovering well together. Practical advice is always available from them regarding baby care. They aim to build your confidence in caring for your new baby. Before you go home, the midwife prepares you thoroughly. They ensure you feel ready for this significant transition. Information about what to expect at home is given clearly. They explain any warning signs to look out for in yourself or your baby. You will receive contact numbers for further support and advice. Necessary paperwork will also be completed then by the staff. This preparation helps you feel more secure and less anxious. You will know who to call if you need any help or have concerns. A community midwife will visit you at home. This visit usually happens the day after you leave hospital. Sometimes it might be on the same day of discharge. The midwife checks on both you and your baby's well-being. They repeat some of the initial health checks for your baby. Your baby will often be weighed again to monitor their progress. They will discuss how feeding is progressing in detail. This home visit provides vital continuity of care and support. During home visits, the midwife checks several important things. They will look at your baby's nappies for wet and soiled output. This helps to show if your baby is feeding well and is hydrated. They will inspect the baby's umbilical cord stump carefully. They ensure it is clean, dry, and healing properly. The midwife also assesses your physical recovery from childbirth. Your emotional well-being is very important too at this time. They may discuss your feelings and signs of postnatal depression. Support is offered if you are feeling overwhelmed or anxious. Another key professional is the health visitor. They become involved soon after your midwife's care ends. Usually they make contact within 10 to 14 days of the birth. Sometimes this first contact happens a bit earlier depending on local services. Health visitors provide longer-term support for families with young children. Their role continues until your child is 5 years old. They offer a broader range of advice and help than midwives. They work in partnership with parents to promote child health. The health visitor's initial role is to support you and your family. They offer guidance on your child's health and overall development. They will discuss important topics like future immunizations for your baby. They can help with common parenting challenges and offer practical solutions. Screening for postnatal depression is also part of their routine role. They aim to support the well-being of the entire family unit. This first meeting helps to build a supportive and trusting relationship. They are a valuable resource for parents navigating early childhood. A pediatrician may also be involved in your baby's care. This is common if there are specific health concerns identified. For example, if your baby was born prematurely and needs extra checks, or if there were any complications during the birth process. Pediatricians are doctors who specialize in children's health from birth. They perform a thorough newborn physical examination if required. This detailed check is often done before hospital discharge for certain babies, or it can be arranged shortly after you go home if needed. The Newborn Infant Physical Examination, or NIP, is vital. This comprehensive check is usually done within 72 hours of birth. It can be performed by a specially trained midwife or a pediatrician. The NIPE looks carefully at your baby's eyes for any abnormalities. It checks their heart sounds, their hips for stability, and for boys, their testes. The main aim is to identify any potential problems as early as possible. Early detection means that any necessary treatment or referral can begin promptly. This ensures the best possible start in life for your baby's health. Your newborn will be offered a hearing screening test. This test usually happens before you leave the hospital. Alternatively, it can be done at a home visit or in a clinic. A healthcare professional, often a hearing screener, will perform the screen. It is a quick, simple, and painless test for your baby. It checks if your baby can hear well in both ears. Early detection of any hearing loss is very important for development. It helps with their speech and language development later on in childhood. The newborn blood spot test is also essential for your baby. This is often called the heel prick test by parents. It is usually done when your baby is 5 days old. A community midwife often performs this test during a home visit. A few drops of blood are taken from your baby's heel. This blood sample is then sent to a laboratory for screening. It tests for 9 rare but serious health conditions. Early diagnosis allows for prompt treatment and effective management of these conditions. Feeding your baby is a major focus of early care and support. Midwives and health visitors provide extensive support in this area. They offer practical help with breastfeeding techniques if you choose this method. Guidance on responsive feeding is given to all mothers. This means feeding your baby when they show signs of hunger. They assist with correct positioning and attachment for comfortable and effective breastfeeding. If you choose to bottle feed, they advise on safe formula preparation and feeding. They ensure your baby is getting enough milk and thriving well. These first 5 days are a critical period for mother and baby. The care received lays a strong foundation for the future. It supports your baby's immediate health and their ongoing development. It also helps the mother's physical and emotional recovery after birth. Good early care helps families adjust to their new life together. It empowers parents with confidence and essential knowledge. The network of NHS professionals ensures a safe and supported start. This comprehensive support system is invaluable for all new families in the UK.